I do have a favorite drug. It's a funny story.
Which is,
A utility company truck, 27,000 pounds, ran a stop sign and took the engine off of my car, but it didn't hit me. It missed by half an inch,
oh
which
my
is,
goodness.
well, it was, miraculous. I did see the white light and all that stuff, but I was a little bit messed up in my head. There was
Mm,
a little bit of anxiety, depression, agitation.
mm.
And one of my friends, who was the researcher who discovered Wellbutrin, said, yeah, why not? Give it a try. And I thought, okay. I mean, I certainly wasn't functioning optimally. And about 30 days after I was taking the lowest dose of Wellbutrin, I was sitting in my office and thought, wow, I love this drug. There's nothing in my head. I'm just sitting in my office feeling happy.
Ladies and gentlemen, welcome back to another episode of Therapists Unmasked. Introduce yourself, tell us your name, where you're from, what you do for work, and what your views are on mental health.
I'm Dr. Ethan Levine. I currently am one of the founders of a integrated healthcare company, Eventus WholeHealth, and we started 11 years ago. We provide mental health, physical, primary care, psychiatry, podiatry services to long-term care residents. Currently, we're in 1,500 facilities. If you want to know how I got into the mental health business, it's a interesting story. It's not what you think. It's not because I care about people or have any passion whatsoever about it. It's because when I was a kid, I had an uncle who turned out to be a psychologist. And I mean, I didn't know what a psychologist was, but what I did know is at Christmas time when he asked me what I want for Christmas. I said this cool toy, game.
Mhm.
And my parents said, please get him something educational. And he said, well, they're not going to make me take it back, so I'll get you what you want. So I thought, well, this guy's cool. Well, what do you do? I'm a psychologist. All right, I'll become one too. And like I said, I got in the field for an absurd reason and found a way to create really two careers, which have been satisfying in different ways. My current role, I get to be an organizational psychologist because I'm a founder, and I also get to be a clinician and it's not the clinical work, it's coaching, mentoring others. But I'm like everybody else. I deal with stuff has impacted me, and I recognize that, and I'm not the only one. I'm the POA, a power of attorney for my mom who has advanced dementia. My brother has currently a very severe episode of bipolar depression nothing works anymore. And it's been 3 years. So that doesn't motivate me to do what I do. It just helps me
Mm.
empathize more with both the clientele I might work with or help clinicians better deal with that. My view on mental health, it really splits into two different pieces. I think by and large, most of us, we're on a range of emotionally with anxiety, depression. Everybody experiences those things. It's just how far out on the bell curve are you? And for most of us, I find that people who experience mental health issues, myself included, when I feel like I don't have choices, then I will get depressed or anxious.
Mm.
Or
Okay.
I feel like I have too many choices, I will get depressed or anxious. And that's one whole bucket, which is, to me, the majority of mental health issues. I'll give you a real interesting example. People limit their belief in what might be possible. When I was interning, I did interned at the University of North Carolina Medical School, and I had a family come in with their son, and they told me they were moving. Husband took a job in Tennessee, and they were willing to commit a year. Mother would stay back with the son while he got the appropriate treatment. And, and then they would move. And I said, sure. So I did an evaluation of the kid, and delightful young man, very bright. And I sat down with the parents. They were very anxious because they felt like, there's a problem there that it's going to take a year plus to solve or get to the point where they could move. And the first thing I said is exactly what I just said to you. This is a very bright, delightful young man. And he was 11. And they looked at me like this, like, what? What do you mean? He's bright? We thought he was developmentally delayed. And that was the source of these problems. And I had done some diagnostic testing, and the kid tested with an IQ like around 130, which is reasonably bright.
Yeah.
But it turns out he has a sibling who tests around 170. So they were comparing this kid to their sibling, treating them as though they were developmentally delayed. And the long and short of it is they went, wow. Came back a week later, said, we're all moving. We started treating him like a bright young man, and all of a sudden his behavior looks like a bright young man. Is that a miracle cure? No. I mean, it's just pointing out some data that helped, the parents think differently. And I think that a lot of us, have our perception. We all have something about ourselves that we are critical of or anxious about. You'll laugh at this, but I mean, it really illustrates that same kind of principle. I was a good athlete, but I've always perceived myself as overweight. Always thought of that. Where it comes from is when I was in elementary school, I was playing ball and I was the hero in a game. Last inning, we were down by 2 runs, bases loaded, 3 balls, 2 strikes, and I hit the ball off of the wall, just barely missed the home run. We won the game, and I hung around to watch other games, and I heard some kids talking, and they said, yeah, some fat kid beat us in the last inning. And somehow, for me, that stuck with me as my own self-image. For me, it was just some kid making some stupid comment. I was a big kid. I think the majority of people who have mental health issues, it's something that can be easily changed, fixed, given more choices. I mean, there is a group of people who have some kind of biochemical issue. It may be a chemical imbalance, something that leads to psychosis, schizophrenia. There's some genetic prevalence, but this is just my opinion. I think the majority of people who are in need of or would benefit from mental health services are that other category.
The fact that you remembered exactly how many innings, how many people were at bat, all of that because of that one moment that stuck with you. It's incredible how much one moment, which to some people can be very insignificant, has made that memory.
And I think that we all, if you tell me, what it is that really bugs you about you, and we sat down to talk, um,
We'd be here for 3 days.
Yeah, that'd be a whole conversation.
no, I think that there's something, and here's the other part for me as a clinician. I'm a behaviorist. I mean, I really think that things can be changed and people's lives can be altered in a very short period of time. I mean, I use some techniques. I have been able to help people basically eliminate fear, phobia, in an hour or two. I
Mhm.
mean, it works and it was worked and lots of times. I think part of the problem is our mental health system's broken a little bit. So when I discovered some of the techniques that I've used related to fear, anxiety, phobia, I mean, I can tell you how to get rid of a headache in 30 seconds or less. No meds involved whatsoever. I called up a university, I'll be kind to them and not mention their name, and ask them, how long does it take them to treat a fear or phobia? And they said, well, at the end of a year, they'll be pretty clear about what the phobia is. And by the end of the second year, have a 90 something percent success rate. So I thought, okay, now it takes me 2 hours, maybe an hour, but let's be, fair. Let's say 2 hours. So I called up Blue Cross and Blue Shield and said, okay, let me describe this situation. How are you going to compensate me? And Blue Cross and Blue Shield said, well, how many hours did you spend? I said, two. Well, we'll pay you for 2 hours. And I said, so something's wrong if somebody can spend 100 hours and get the same outcome I can in 2 hours, but they get paid 100 times the hourly rate, and I get paid two times the hourly rate. Something's wrong with that. So we've created this, mental health business. We're not paying people based on outcome. We pay people based on time. And that's a real limiting factor. I mean, even in the current business that I'm in, we have all the disciplines, the primary care, psychiatry,
Mhm.
psychotherapy. And psychotherapy, we struggle to recruit, and the compensation is lower than the other disciplines because, as a minimum, you have to see somebody for 16 minutes. I mean, we can't bill. I mean, that's just, Medicare guidelines, or every insurance. So if I can do the thing that helps you overcome how you're feeling, why does it have to be time-based? So I think the system's broken. If I were changing the mental health system, I would make it a outcome-based system, whether it takes me an hour or a couple of years, whatever it is. And I've mentored a lot of psychotherapists along the way. I currently have almost 100 people in my organization. My role is director of psychotherapy, change management, and clinical trials for us. And
Wow.
there's about 100 clinicians, and it's frustrating to recruit and retain people when they have to see people for 16 minutes. You have to, you can't bill, legally.
So you are one of the leaders of Eventus WholeHealth.
Yeah,
And
and I've stepped back some because of, my mom's situation, my brothers,
mm,
and having a granddaughter. But I mean, I'm one of the founders of the company, and I'm the leader of the psychotherapy services.
which is amazing because I work in a mental health clinic that is also like consists of psychiatrists, nurses, all of that. And it is very corporate-y, and I experience burnout often, which affects my performance as a therapist, which honestly sucks because there's nothing that I love more than what I do. And I wish that my job could have like mental health services in the workplace on site for the employees like me, so I can do my job more effectively on the days that I feel burnt out. With that being said, tell us a little bit about Eventus Whole Health and how you implement mental health services for your employees.
A couple of different ways. One is, and this is just my own belief. I believe you control how you feel, and you can reframe anything. And people who interact with me would describe me at times as irreverent. My favorite saying is, I've been thrown out of better bars than this one, so I'm going to do this anyway. And if you have that attitude, you'll have more fun at work. You don't have to go to
Mhm.
a therapist to have more fun, just have more fun.
Yeah.
And it will make people crazy because they're like, why are you having fun? Because you choose to have fun. So, I mean, we're very supportive of our staff doing what they need to. People call me when they need to call me. If I were in a private practice, I would operate under the same principle. You don't need to be in therapy for years. Call me when something's going on that you need to get some help. I think that in a way, getting therapy becomes addictive. One of my best friends who I trained when she was in graduate school, and she has a private practice, and she was telling me, I have several people I've seen for 18 years, 20 years, and I'm like, damn, I didn't do a very good job supervising. That shouldn't be happening.
In the
I,
clinic I work at, I just got transfer clients from a woman who retired after 30 years. And I got a transfer client who she's seen for about 18 years. And I'm like, what's going on? Let's look over your goals. Like, why you're still here? What do you want to work on? Because
yeah,
that's a long time for
it is a
therapy.
long time. So, I mean, I'm not discounting the need to have support services, be
Hmm.
it therapy or EAP or whatever it is, when you need it. I think that's absolutely critical that somebody be there, and it shouldn't be your best friend, your spouse, because you need to lean on somebody who's objective. I think companies need to recognize if you have healthy people, you'll have a healthy company. When I first started at GlaxoSmithKline, we had fitness centers, we had running trails. To me, that stuff is probably as important, if not more so, for mental health, knowing that you don't have to work X number of hours in a row, that if I need to go for a run at 2 o'clock, I go for a run at 2 o'clock. My mom sleeps about 18, 20 hours a day. So the only window of when I can see her is between 9, 12 in the morning. I didn't ask for permission to go see my mom between 9 and 12 in the morning. It's important, so I'm doing it. And I haven't gotten any pushback whatsoever. So, I mean,
Hmm.
that's the kind of thing we do, is you give people the latitude to do what they need to do to keep themselves feeling good so that then they'll be more productive, then they'll like working in your company more, and they'll provide better services.
I think you should pay a visit to my clinic.
And mine, definitely mine too, because we see like 14 clients a day for 30-minute sessions back
That's a
to back.
lot. That's
Yes. We actually don't really get a break. Technically, we do get two 30-minute breaks, but like those breaks are really for paperwork time. So it's not like we can just like go out for a walk and take a little break because we just need to do our paperwork. So what advice would you give other employers like mine that
yeah.
can implement mental health services in the workplace?
Just as a sidebar to that, when I do training of new therapists, I always lead with, I can teach you how to earn more money and work less hours. Because if you know how to be efficient, it may be different in your clinic, but in long-term care, there's absolutely a system that you can follow. You'll maybe be in the building 4 or 5 hours a day, and then you can go home and sit in your sweatpants and write your notes or your shorts or whatever you like. Because if you follow the system, I guarantee you'll earn more and work less. But my advice would be, I would reframe the question. And I would frame the question as, how important is longevity in the success of your business? How
Mhm.
important is engagement in the success of your business? How important is people referring other people to come work to your business? How
Mhm.
important is it, do you think, for your clientele when you have passionate, engaged, happy therapists?
Mhm.
So I would be asking questions. It's appreciative inquiry. Ask a lot of questions, and they'll come up with the conclusion on their own that they need to change their system because the system's broken. If you have a system like that, eventually you burn out, or worse, you stay in place and burn out and don't quit. It doesn't work. It's not a formula for
Yeah,
success.
no.
I value having a caring supervisor that genuinely checks in on me. And I do have that with my clinical supervisor who will pass by my office as he's walking by and he's like, "How are you?" And I'm like, sometimes I'll be like, "I'm overstimulated." And he'll stop and he'll be like, "All right, like what's wrong?" But in general, not everybody has the luxury of having bosses that check in on them. How do you think leaders or managers can implement a supportive workplace?
Well, again, I'd ask the question differently, which would be, how can employers hire the kind of people or promote the kind of people that will be good managers? Because if I'm not empathic, then I don't care what training you put me through, I'm not going to be empathic. I'm not going to get it. I think that a lot of companies will hire based on where you work, what things you did, rather than who you are. And I think if companies changed their or appreciated the impact of managers more, they might hire differently. Best leader I've ever worked with is a guy who's now a CEO of a pharma company. And he told this great story. You know, the bottom line of it is people don't care how much you know until they know how much you care. And so that's how he operates as a CEO. You want to know my favorite question when I'm interviewing? Tell me how you're going to screw up when I hire you. Because I never get burned by you being better than what I think. I get burned by the things I didn't know. And
Hmm.
there is no right or wrong answer, but there are clues as to who the person is. I interviewed a guy for a CFO job, you know, finance job, and his answer was screw up, screw up. He couldn't conceive of it. So here's the psychoanalytic interpretation. He is going to screw up. We all do. And when he does, he's going to hide it because he couldn't conceive of it. So we didn't hire him. You know, from the perspective of managers, not everybody should be a manager. It's an art form more than it's a set of skills.
Hmm.
You know, you can rotely go through checking on your employees, but that doesn't mean you're a good manager. Probably one of the things I'm proudest of in my career, I've had people follow me through 4 different jobs, you know, because they want to work for me.
The reality of it all is that we're all gonna mess up. We're all learning.
I
Uh,
do every
I,
day.
yeah, I told my supervisor actually asked me, Samantha, why do you ask so many questions when in supervision in terms of a client or how to manage a case better? And I said, I ask questions because I am still a sponge. I'm 2 years in and I'm still learning everything. So anything I can acquire, I will ask questions multiple times in order to know that I'm doing my job correctly. She found that very interesting because I guess in her eyes, asking questions is for many therapists, if they ask too many questions about a client or about a case, in a way, it's kind of them retreating and not really and avoiding wanting to take that case, which I found very interesting because if I want to avoid that case, I'm not going to talk about it.
Right. Yeah, I mean, I think that it's that limiting perception. You know, they
Hmm.
have a box that they're looking at you rather than let me listen and understand who you are and help you figure out. You're smart. You can figure out what you need.
Hmm.
So let's work together and partner. I mean, that's how I lead, manage, let people let me help them figure out what they need and connect them to the right resource. It may be me, it may be somebody else, doesn't matter. You know, you're asking about how you change the environment to support mental health. I think you create a culture where it's okay to ask the tough things. It's okay to give the difficult critique, because otherwise you're never going to change and it's never going to be better. And a
Hmm.
really smart leader is one who says, I really appreciate that. You know, so if I've screwed up, I want to know. When I was at GlaxoSmithKline, I ran the Research Triangle Park based business, you know, the organizational development, organizational psychology, and I had a colleague who ran the piece up in Philadelphia. You know, it was a merger from Glaxo Wellcome and SmithKline Beecham. And she told me once, she said, I hate you. I said, okay, why do you hate me? Because you screw up, you figure out how to fix it, and then you tell me you screwed up and how you fixed it, and I can't get mad.
At least you did something to rectify the situation.
Well, yeah, but I mean, it's if you're only looking for flattery, you're going to fall short on your face.
Hmm.
And in therapy, I mean, it's true too. If people are constantly looking to be basically reinforced or told, "Oh, you're fine," they're missing the point of therapy.
Hmm.
Point of
Yeah.
therapy is to address the stuff where you're not fine and let's make it better.
Absolutely. And Dr. Levine, I just want to give you a quick question. Give
Yeah.
me the short answer for it. What advice would you give somebody that is trying to get into the mental health field?
I think get experience so you understand what you're getting into, whether it's working in a hospital, volunteering, understand what you're getting into and do a gut check. Is this what I want to do in my life? I mean, is this really me? Honestly, I may be a very good clinician, but that's not my passion. My passion is the organizational psych stuff and coaching and mentoring. I'm happiest with unbelievable amounts of complexity. In fact, if you make it too simple, what you ask me to do, I don't like it. I'm bored. I want you to give me the impossible to do, and I'll be happy. So the gut check on me, I mean, we were talking in the beginning about why did I get in to becoming a psychologist. I didn't know what I was becoming, but the skill set, on the other hand, really has served me well in those other roles.
Mm-hmm.
So
Absolutely.
just understand what you're getting into. And I'm happy to
100%.
come on again if you want.
Of
Happy.
course. My goodness, I've learned so much. And also the validation of knowing. It's great. We know you have to leave very soon, but very quickly before you go, where is your mental health at today on a scale of 1 to 10? And if it's not in the place where you feel it could be, what could you do to make it better?
You're talking to me personally, right?
Yes.
Yes.
No, I mean, I'd say it's in that um 8, 9 range. And the biggest thing for me to get it to that 8, 9 range, I mean, it's partly what I do going forward, but it's partly retrospective, is accepting the things I can't change. I mean, I can't change my mom's dementia. My mom is actually the brightest person, most gifted person I've ever met. Got a doctorate at age 55, was a psychologist, went back to school, became a psychoanalyst. And to see someone who's so gifted basically, dying,
Mm.
that's hard.
Mm-hmm.
But accepting that she's still the same person, she just can't make the connections to get it out there. So accepting things that you can't change, that's the biggest thing. And it's always a challenge. Because like with my mom or with my brother, one day to the next, there's going to be good days and bad days.
Mm-hmm.
Actually, bad days and worse days. And that's never good.
Mm-hmm.
Good is when I used to go on 5, 6 mile walks with my mom, stop at the fish store, and everybody loved her. And they'd give her samples, which were in full-size gallon containers, of the soup they just made. That's gone. It's all gone. So learning to accept, what you can control, what you can't control is the secret to getting. I'll never be at a 10. I don't want to be at a 10. And I want something to strive for.
I really appreciate how you came on here just to spread that awareness that like it is possible to implement mental health in the workplace, right? Because like I said, clinics like mine, they don't know what that is. And I feel like a lot of the times we're really underappreciated for the things that we do. So to know that there's people like you who really find this important is amazing. And so thank you so much for coming on to
Of
talk
course.
to us about that.
No, I appreciate getting to know you a little bit and love to know more. So please feel free to reach out.
Awesome.
Definitely will. Thank you so much.
All
All
right,
right,
take
Doctor.
care.
Thank you, you too. Bye.
Bye.
All right, everybody. Thank you guys for watching. Please like, subscribe, comment, share this with your friends and family. Listen to us on Spotify and Apple Podcasts. You can also follow us on TikTok and Instagram, Therapists_Unmasked. And we'll see you guys next time. Bye.